Hello, my name is Andrea. I'm a registered dietitian with the Prostate Cancer Supportive Care Program. Today's session is nutrition for prostate cancer patients. Welcome to this session, and we thank the support of a variety of organizations to make the Prostate Cancer Supportive Care Program possible. It was created in 2013 with initial funding from the Special Services Committee, which is a joint collaboration between the Ministry of Health and Doctors of BC, as well as donations made by individuals. Over the years, we partnered with BC Cancer and the Prostate Cancer Foundation of BC to expand our program, with the goal to reach every patient with prostate cancer who desires our supportive care services. Finally, we are very grateful to the donations made by individuals to the Prostate Cancer Supportive Care Program. This session is meant to be a general session. Medical concerns should be brought to your doctor. And if you are unable to attend the session in its entirety, please feel free to pause and return to the program whenever you're able to. The Prostate Cancer Supportive Care Program is a comprehensive program designed to help patients and their partners across the entire disease trajectory. There's a number of modules in the program, as you can see, and you can contact the program coordinators, and the numbers will be provided at the end of the session if you have questions about these sessions. So today's session is from the lifestyle management module, and we're talking about nutrition today. We'll be discussing the benefits of healthy eating, what is a balanced diet for prostate cancer, which foods and nutrients are of interest when it comes to the prostate, and how diet is involved in managing symptoms that may occur with the prostate cancer and prostate cancer treatment. The benefits of healthy eating, first of all, are to help you feel your best. In a healthcare setting, we are often focused on our physical body, but we're also wanting to think about how our food choices make us feel. So we are looking at how the fuel that we eat physically nourishes our body, but we want to consider the role of nutrition and foods in our mental, social, and spiritual well-being. There's a lot of misinformation when it comes to diet and cancer, which can cause confusion and stress for some people. So feeling confident about your food choice is important. We can also use nutrition to help us manage some of treatment-related side effects. Some side effects can include urinary incontinence, but as well as bowel changes, such as diarrhea, changes in appetite, changes in our muscle mass, and our body composition in general. Lifestyle change holds promise to slow growth of prostate cancer and the chance of it returning. And there is ongoing research to understand how body weight and dietary factors, such as specific foods, vitamins, minerals, and other food compounds, affect the growth of prostate cancer or the chance of prostate cancer returning. While not yet proven, research hints that eating some foods and limiting others may be helpful. We'll be highlighting these for you today. Healthy food choices are also important for maintaining or improving your overall health. This is an important area to consider, as some treatments for prostate cancer can increase the risk for conditions such as osteoporosis, heart disease, and diabetes. One of the key focuses, especially if you're receiving ADT, or androgen deprivation therapy, is to eat in a way to help maintain or improve body composition. We'll talk about more of that today as well. As a cancer survivor and an individual, you may have unique nutrition needs that affect your food choices. If you have multiple health conditions or want guidance to manage side effects from prostate cancer treatments that are making it difficult for you to eat, you can book an individual session to speak with the dietitian one-on-one. Cancer diagnosis can change the way our body uses nutrients, especially with cancers that involve hormones, such as breast and prostate cancer. The change in level of hormones combined with inflammation, either localized around the prostate or throughout the body during chemotherapy, impacts metabolism. With hormone therapy in particular, this can result in a loss of muscle mass and an increase in the storage of fat, affecting your body composition and your shape. Longer term, for more than 6 months, hormone therapies can affect your bones. This, combined with a Western diet and lower physical activity, can, in the long run, increase the risk for other types of cancers, heart disease, diabetes, osteoporosis. So taking steps to adjust your diet to mitigate some of these changes can benefit your health in the short and long term. What we're focusing on is having an anti-cancer diet. You've probably seen that many foods hold the claim of having cancer-fighting properties, and there are many ideas floating out there and preliminary research being done on some of these ideas. When we discuss a healthy or anti-cancer diet today, we'll be referring to a diet that has a strong evidence base in scientific literature. And there's 4 main pillars to this diet. A diet rich in plant foods, and this doesn't necessarily mean vegetarian. The more plant-based proteins and less animal-based proteins. Also focusing on foods that are minimally processed. Minimally processed foods are foods that are in their more natural state without a lot of added fats, sugars, and salts. And we're looking at including healthy fats. So it's not about eliminating or low fat, but looking at the quality of the types of fats that we're eating. A healthy diet is only part of the puzzle. We need to consider the overall lifestyle. And there's many studies that you could look into. A great resource for more information on this is the American Institute for Cancer Research. Their website is www.aicr.org. So, thinking about this diet, one of the key pillars being whole food based. So again, less processed foods. A whole food plant-based diet is a pretty generic term, and its broadest definition, a plant-based diet is a diet built around mostly plant foods. So those include our vegetables, fruits, whole grains, beans, nuts, and seeds. Eating a plant-based diet does not mean you need to eliminate animal foods, such as dairy products, meat, fish, or poultry. Overall, the goal is to eat more plant foods and fewer animal foods. When planning meals, think of plant-based foods as the centerpiece rather than meat or other animal foods. When you create a healthy diet built on fruits, vegetables, and other plant-based foods, it leaves rooms for moderate amounts of other foods like lean beef or other animal foods that are still a good source of protein, iron, and zinc. Of course, a completely vegetarian diet is a healthy option as well. Plant-based diets offer powerful health benefits, including lower risk for cancer and many other chronic diseases. And choosing a diet that puts plant foods first also helps support a healthy body weight, an important lifestyle factor for reducing risk of cancer and many chronic conditions. As you adopt a plant-based diet, one important principle to keep in mind is to choose foods that are minimally processed with minimally added sugar and fat. So think about frozen fruit, vegetables, or cooked whole grains, canned beans, bags of shredded or chopped fresh vegetables and fruits, and nut snacks. A plate that regularly contains fried foods, sweets, and other highly processed foods with added sugar and fat, even if all plant-based, isn't healthy. The power of plants. Plant-derived foods provide vitamins, minerals, fiber, and phytochemicals. Phyto means plant. So these are plant-based chemicals or nutrients. And they are mainly found in our vegetables and fruit, whole grains, legumes such as beans and lentils, and nuts and seeds. There are thousands of different types of phytochemicals, such as lycopene, found in foods such as tomato products, and flavonoids, found in fruits, vegetables, and beverages like black tea and green tea. And these compounds give plants their characteristic color, distinctive taste, and aroma. In experimental studies, phytochemicals show various anti-cancer properties and other health benefits. A plant food, such as vegetables, fruits, whole grains, beans, and lentils, dried and nuts and seeds are rich sources of phytonutrients or phytochemicals. Individual foods, though, are complex, and they don't just provide one single vitamin, mineral, or phytochemical or other compound. For example, cruciferous vegetables like broccoli can potentially reduce the risk of prostate cancer progression. And the component responsible for these benefits is thought to be sulforaphane, which is formed almost exclusively in cruciferous vegetables. But broccoli provides much more than just the precursor of sulforaphane. As you can see, it's a source of vitamin C, K, folate, as well as minerals such as potassium and calcium, and of course, an excellent source of dietary fiber. So the focus of this is to think of eating whole foods rather than individual components that we get from our foods. And one way to do this is to eat the rainbow. The idea of eating the rainbow means variety. We're looking for variety in the color of our fruits and vegetables, but our other plant foods, as you can see, various legumes and beans and lentils come in different colors, as do whole grains and nuts and seeds. This again signifies those different phytonutrients, indicating more health promoting properties. And as we also noted, food is not just one component. There's multiple components in food that act synergistically together for the greatest health benefits. This is a plate from the Canada's Food Guide, and it's a great tool for planning a plant-based eating pattern. Ideally, we want most of our meals to be balanced like this, where half of our plate is filled with vegetables, ideally non-starchy types of vegetables. We're going to talk more about that later, as well a quarter whole grain and a quarter protein. By following these ratios, we consume the right amounts of nutrients we need to promote health. And we're going to look a little bit more closely at each of these groups individually. So fruits and vegetables we want to fill the largest part of our plate with fruits and vegetables, half of the plate at most meals. Fruits and vegetables contain vitamins, minerals, phytochemicals, and fiber, and are mostly naturally low in calories. Again, the less processed, the better. In a plant-based eating pattern, choosing mostly non-starchy vegetables is recommended. Non-starchy vegetable is every vegetable other than potato, yam, and corn. We want to choose the less processed, so unsweetened, and it can be fresh as well as frozen or canned fruits and vegetables without added salts and sugars. We want to eat whole fruits and vegetables. The whole fruit and vegetable rather than the juice provides plenty of fiber. Juice, when we consume juice, we can easily consume much more calories than we would get from eating the whole fruit. And we've lost the benefit of that fiber, which we know provides a number of health benefits to the body. Aim again for a variety of color, especially look for dark green vegetables, yellow, red, and orange ones. It's still okay to include some starchy vegetables in your plate like potatoes, yam, and corn. We just don't want them to fill up most of our plate most of the time. If you are someone who is enjoying juice, you might want to take some steps to try to reduce the frequency or the amount, or even switch over to a blended fruit option like a smoothie, where you're still getting the fiber. Water is one of our best choices for hydration. One of the vegetables that's of greater interest when it comes to prostate cancer is the cruciferous vegetables. And this includes broccoli, cabbage, cauliflower, kale, Brussels sprouts. And research has shown that these vegetables have a fairly strong cancer preventative property. And higher intakes have been linked to lower risk of developing aggressive prostate cancer. In people with prostate cancer, there is one study that suggests that higher intakes, so here we found people who ate more than 5 servings of the cruciferous vegetable a day compared to those who ate less, fewer than just under 1.5 servings a day, had almost 60% lower risk of progression of the prostate cancer. So, I mean, one study doesn't prove that this is a vegetable that will stop the progression of prostate cancer, but it is certainly a very interesting study. And we know that the cruciferous vegetables are rich in other beneficial nutrients and compounds for our health. We do encourage you to eat cruciferous vegetables on a regular basis, daily, if you're able to. Another food of interest for prostate is tomato. And tomato is a rich source of lycopene. It's a phytonutrient or phytochemical with strong antioxidant properties. And studies are showing a protective link between lycopene and prostate cancer. Though the research is promising, not all studies have shown a link. And the ideal daily amount of lycopene to consume is not known. Studies have looked at intakes in the range of 4 to 30 milligrams of lycopene a day. And these amounts can be achieved by including lycopene-rich foods as part of your diet. As you can see, something like tomato puree, which might be used in a soup or a chili kind of dish, provides about 30 milligrams of lycopene in a half-cup serving. Although there's not enough proof to recommend lycopene supplements, we do encourage you to eat these types of foods also on a daily basis. Another food of interest when it comes to prostate is soy. Soy foods are a source of phytochemicals, as well as a source of a particular type of phytoestrogen. And the thought is that these might prevent the growth of hormone-sensitive cancers. So studies in breast and prostate cancer survivors for over a decade have shown that eating soy foods is safe and may play a beneficial role as part of a healthy diet. Although the research is suggestive, not all research has found benefit. And so there is a lack of compelling research to say that soy foods are a must-have to prevent prostate cancer progression. But because we know that these are generally healthy foods, a great plant-based source of protein, they are something that can be encouraged as part of your plant-based diet that can add variety. Keeping in mind that these are healthy foods, a good source of fiber, as well as minerals, protein, and they're naturally low in saturated fat. And moving on to another part of our plate, are whole grains. Whole grains are also a nutritious option for fiber and energy. They help to promote good heart health, healthy body weight, and a healthy digestive system. A whole grain includes all 3 parts of the grain: the outer bran, the inner germ, and the energy-filled endosperm. And each section houses health-promoting properties. The bran is the fiber-rich outer layer and provides B vitamins, iron, copper, zinc, magnesium, antioxidants, and phytochemicals. The germ is the core of the seed where growth occurs. It's rich in healthy fats, vitamin E, B vitamins, phytochemicals, and antioxidants. The endosperm is the interior layer that holds the carbohydrate and some protein and small amounts of B vitamins and minerals. When we refine the grain, the bran and germ layer are removed, and you can see that's where a lot of the phytochemicals are found. And so there's a loss of that nutrient in the refined grain. And when we refine the grain, because we've stripped away the fiber, it does change how the body processes the carbohydrate, and we lose the benefit towards our digestive system. Eating whole grains can help us feel full longer, which can help us manage a healthy body weight. When you're thinking about this part of your plate, don't only think about quantity. We want to think about quarter of our plate for these whole grains, but really think about quality, choosing more often the intact whole grain. So eating things such as brown rice, black rice, red rice, oats, barley, quinoa, farro. A lot of different interesting ancient grains are available and often found in the natural food section or bulk food section of your grocery stores. The remaining quarter of our plate is for our protein foods. And protein is an important nutrient. It plays a role in almost all body functions and is a key building block of bones and muscle. Getting enough protein can help you keep your immune system healthy, so you fight off infections, keep your muscles strong, so you can do the everyday activities you want to do, and help you heal and recover more quickly. Eating plant-based proteins, such as beans, lentils, nuts and seeds, and soy foods, is encouraged, at least daily or at least regularly throughout the week. And all plant-based proteins are good options. Plant-based proteins, again, are the cancer-fighting component in the protein section of our plate. This is where we're going to find our phytochemicals. Animal-based proteins are still and definitely a good source of protein, actually a more concentrated source of protein, but they do tend to be the source of saturated fat or the artery clogging fats in our diet, and they don't provide the cancer-fighting components that we would get from our plant-based proteins. So in a healthy cancer protective diet, again, to emphasize, we're not saying that you need to have a completely vegetarian diet, although it is an option, animal-based protein foods are still an excellent source of protein, iron, and zinc. We just want to think about them as the less frequent protein choice in our diet. Red meat, does that fit in a plant-based diet and a healthy anti-cancer diet? Red meat includes beef, pork, lamb, and goat. So foods such as steak, hamburgers, ground beef, pork chops. Processed meats include any meats that's preserved by smoking, curing, salting, or with the addition of chemical preservatives such as nitrates. So that would include ham, bacon, hot dogs, and many deli meats. Research has linked eating too much red meat, which would be more than 500 grams in a week, and eating any amount of processed meats with an increased risk of colorectal cancer. Some research suggests that this type of food in the diet is also not healthy for the prostate. We recommend, if you eat red meats, that you don't have more than 500 grams in a week, and as much as possible, try to avoid processed meats. How about fish, chicken, dairy, and eggs as animal protein options? Do they fit in a healthy diet? So as I mentioned before, these types of foods are a good source of some nutrients, such as iron, calcium in our dairy products, and omega-3 fats in some of our healthy fatty fishes. A healthy diet can include moderate amounts of skinless poultry, fish, eggs, and low-fat dairy products if desired. When choosing fish, we do encourage a couple times a week to include fatty fishes such as herring, mackerel, salmon, as they're a good source of omega-3 fats, which are heart-healthy fats. When we're having dairy products, we encourage you to choose lower fat dairy products rather than the higher fat ones, which could provide that artery clogging saturated fats. So let's put this all together. A key tool for healthy eating is our plate. Filling half our plate with vegetables and fruit and choosing mostly non-starchy vegetables is encouraged. We do encourage you to eat tomato and broccoli or other cruciferous vegetables often. Choose fruits of a variety of different colors. Include whole grains in your diet, and remember here, quality and quantity, up to a quarter of your plate, and choosing grains such as brown rice, barley, wheat, rye, farro. If you're having breads or pasta, look for those made with whole grains. In the quarter of your plate for protein foods, choose plant-based proteins such as beans and lentils and soy foods often. Fish a couple times a week is a healthy choice. Including nuts and seeds as part of your protein options is also encouraged. When eating poultry, remove the skin from the poultry. And if you do include red meat, limit that to 500 grams a week. As much as possible, try to avoid processed meats. So let's think about what this looks like when we talk about real meals. A piece of whole grain toast with some avocado, tomato, and an egg, or a bowl of granola, some berries, and yogurt. These are examples of plant-based meals. Other ideas might include a stir-fry kind of dish in the lower right-hand corner with some multi-grain rice. So there's some stir-fry with lots of vegetables included, some bok choy, peppers and onions, and snow peas. In the lower left corner, there is a quinoa salad with black beans and avocado, peppers, tomatoes, and for a little hit of flavor, some feta cheese. In the upper left corner, here we have some potatoes. So as I mentioned, it's not about eliminating these foods, but limiting them. So here the potato is used as the carbohydrate or grain food in the meal, along with a large salad and some chicken cubes. And then there's a lentil soup in the upper right-hand corner with a salad and a piece of whole grain bread. So plant-based eating can be very familiar. It doesn't mean that we're eating different foods. Often it might just mean we're changing the proportions in how we fill our plate, emphasizing more of the vegetables, switching out some of those refined grains for whole grains, and limiting those protein foods to about a quarter of the plate, trying to bring in more beans and lentils and other plant-based protein foods. Moving on to another pillar of our healthy diet is including healthy fats. There are two main types of fats classes. We'd say saturated and unsaturated fats. The saturated fats are the less healthy ones, and the unsaturated ones are the healthier type of fat to be including. Including unsaturated fat rather than saturated fat can help with lower risk of heart disease, which is a very important consideration because we know that heart disease is one of the leading causes of death in Canada in people diagnosed with prostate cancer. So just to draw your attention here, on the left-hand side, you're having some of the more unsaturated fats, so nuts and seeds, avocado, vegetable oils, avocado oil, olive oil, canola oil, and fatty fishes are good sources of unsaturated fats. And these are heart-healthy fat choices. On the other hand, our saturated fats tend to be hard at room temperature, such as butter, or coconut oils, or fatty cuts of meat. And we've seen that when we roasted a chicken or cooked a piece of meat in the oven and we leave the cooking dish to cool, the liquid fat solidifies at the room temperature. These are saturated fats. While not definitive and more research is needed to understand the effects of dietary fat after a prostate cancer diagnosis, there are some studies suggesting that higher saturated fat intake is linked with increased risk of dying in people diagnosed with prostate cancer, while eating vegetable fats instead of the saturated fats is linked to longer life. That effect may be related to what we see with heart disease. So when it comes to our fats, again, we want to choose more of the unsaturated fats most of the time. Simply following more of that plant-based eating principle includes food sources of unsaturated fats while limiting the animal component in our diet, along with limiting fats such as coconut oil will limit those saturated fats. And then the final pillar of our healthy eating was to focus on minimally processed foods. So the less processed our foods are, the better. Processed foods are contributing more overall calories in the typical Canadian diet than ever before. These foods are easily accessible, and it does take some, it feels like some extra effort these days to focus more on the less processed foods. So stocking our home and creating a healthy food environment within our home by not bringing too many processed foods in to begin with can help us, because we know that eating out and foods away from the home certainly is a big source of processed foods. So the more we can cook and prepare foods within our own home, the easier it will be to eat minimally processed foods. The problem isn't that we eat these foods at all, it's just that we tend to eat too much of them, and they tend to be much higher in the unhealthy fats, as well as high in too much sodium, added salts, and added sugars. One tool you have to help you make informed food choices, and particularly when you are buying some of what we might call minimally processed foods. So these are not completely in their natural state, but they've gone through some processing, and we're wanting to make the best choices in this area, is that we can use the food label on packaged foods. So food labels provide information, and you can access this in your grocery store or even in your home. You might have a can available that you can go and grab right now to look at reading these food labels. We'll try to help you decode some of the information found on the label. So if you have a product container handy and you can look at it, otherwise you can read along on the screen. What we have on a nutrition label is the nutrition facts table, as well as an ingredient list. So the ingredient list lists all of the ingredients in the food product, and the nutrition facts table breaks down the components into how much calories, fat, cholesterol, and other nutrients you're getting from a particular serving of the food. So first, when you're reading the label, it's important to look for the serving size. And the serving size can be found at the top of the nutrition facts table. On this label, you can see it says per 125 mLs or 87 grams, and that is the serving amount. It doesn't refer to the serving that you may actually eat. You may consume more or less than this portion. So then you can read down the label to learn about the food's nutritional value. On the right-hand side of the label, we see the percent daily value, or the DV. If a food contains a little of a nutrient, the DV, or percent daily value, will be 5% or less. If a food contains a lot of a nutrient, the percent daily value will be 15% or more. And that's a useful tool that you can use to compare two similar products to find one that's higher or lower in a nutrient of interest. So if you're looking for something with more fiber or less sodium, you can quickly compare the percent daily value for two similar products. On the label, on the left-hand side, you'll see the actual calories, fat, sodium, carbohydrate, and this is very useful information when you're looking into a particular food and you're wanting to know exactly what you're getting. So if someone is counting carbohydrates or wanting to add up their fiber, they could be using that information to track what they're eating. So this is an important tool that you have in the grocery store. If you want more practice reading labels, you can check at your local grocery store to see if they offer dietitian-led nutrition tours. So that way you'll have a chance to walk around the grocery store and ask questions about particular products that you might be interested in or usually buy and get some firsthand information on those things. Okay, now we're going to move on to talk about some common questions that people ask. And first of all, is it okay to drink alcohol? In general, the recommendation is for men to not have more than 2 standard drinks a day, unless your physician advises you otherwise. A standard drink is 12 ounces or a standard bottle of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. The effects of alcohol on prostate cancer risk and survival is not clear. More research is needed to understand if alcohol affects the growth of prostate cancer. We don't have any information to confirm on that. But we do know that drinking alcohol increases the risk for several types of cancer and is also linked to other health problems such as liver disease and heart disease. So after cancer diagnosis, it's recommended for people to follow cancer prevention recommendations. And when it comes to alcohol, these state for cancer prevention, it's best not to drink alcohol. If you choose to drink alcohol, follow the recommendation of no more than 2 drinks a day. Should I take any supplements? Such a very common question. And not surprisingly, as research suggests that about 70% of Canadians regularly take some form of natural health products. There is a lack of scientific evidence, though, to recommend any single supplement to decrease the risk of prostate cancer progression or recurrence. We are concerned, though, that some supplements may increase the risk of prostate cancer. One important example is in prostate cancer is the SELECT trial, and we'll be talking more about that. At this time, we do not recommend any particular supplements for preventing the growth of prostate cancer, but there are some supplements we will discuss that you may benefit from for overall health. So the prostate cancer selenium and vitamin E cancer prevention trial, or the SELECT trial, was a very large study that it began enrollment in 2001, and the study was actually stopped early because they had some surprising findings. But the purpose was to see if taking selenium or vitamin E supplements together or alone could help prevent prostate cancer. More than 35,000 men over the age of 50 participated, and it was an international study involving Canadian, American, and Puerto Rican men. But the study was stopped early because the supplementation was not shown to be beneficial, but instead harmful. The results suggested that when men who already had enough selenium in their body took selenium supplements, they had a higher risk of developing prostate cancer and a higher risk for prostate cancer when men took vitamin E supplements, which was found. Another study called the Health Professionals Follow-Up Study followed men with early stage prostate cancer. It found that taking selenium supplements after diagnosis was linked to an increased risk of dying from prostate cancer in men taking more than 140 micrograms of selenium compared to those not taking selenium supplements. What these studies and others tell us is that while often perceived as safe or natural, supplements which provide a more concentrated and higher dose of a substance than food provides aren't always safe for everyone. We recommend choosing food first to meet your selenium and vitamin E needs. Our goal is to get 55 micrograms of selenium each day and 15 milligrams of vitamin E each day. Selenium is in a variety of foods, including many of the foods we've already encouraged eating often, such as whole grains, nuts and seeds, fish, and or moderate amounts of animal foods, such as dairy, meat, and eggs. The Brazil nut is a particularly rich source of selenium, with an average nut providing 70 micrograms of selenium a day. The exact selenium content of food will depend on the environment, primarily the soil in which it was grown. Vitamin E is also found in a variety of different foods, including our dark leafy greens, sunflower seeds, and other nuts, wheat germ, again emphasizing the importance of the whole grain, as well as eggs. Many people ask if they should be taking antioxidant supplements. Antioxidants basically are components that can protect cells from damage. Many phytonutrients or phytochemicals work as antioxidants. And preventing this type of damage might help protect us from cancer and other diseases. And a steady supply of antioxidants from our food is needed to provide protection, because the body's continuously under risk of this damage from oxidation. But the best way to get antioxidants is to be eating a balanced diet that includes rich food sources, such as fruits and berries, vegetables, whole grains, nuts and seeds. And this would provide antioxidant nutrients. We don't know that taking antioxidant supplements such as vitamin C, vitamin E, selenium will protect us in the same way as getting the nutrients from food. And we're sometimes worried that the effects might be different when we take a supplement rather than eat a food, such as we saw with the SELECT trial. We do recommend the avoidance of antioxidant supplements during cancer treatment over concern that these types of supplements may also protect cancer cells and interfere with the actions of the cancer treatments. So when it comes to dietary supplements, as I mentioned, there's some that may be recommended for your overall health, such as calcium and vitamin D, if your diet is not providing a sufficient amount, as well as multivitamin and omega-3 fats. If you are undergoing cancer treatment, we do recommend that you avoid most supplements other than those that ensure that your diet is providing sufficient quantities. As long as your diet is not providing sufficient quantities, such as calcium, and for concern over the interaction with the treatments. And if you're not on cancer treatment, I mean, some of those concerns are theoretical and we don't have a lot of research. So I always encourage you to review any supplements that you're taking with your doctor, with a dietitian, and with a pharmacist to ensure that there's no interaction with other prescription medications that you might already be taking. I'm going to talk a little bit more about calcium and vitamin D because they are very important nutrients, particularly for people undergoing hormone therapy. And generally, sufficient levels in the Canadian diet are more difficult to achieve than some of our other vitamins and minerals. So when it comes to calcium and vitamin D, we know that this is involved in our bone health. And osteoporosis is a condition which the bone becomes brittle or less weak. And it can be we can be at increased risk for osteoporosis when taking hormone therapies. We also have increased risk for osteoporosis as we age. We know, though, that getting maybe too much calcium is linked to more aggressive prostate cancer. So we're wanting to really be careful to get enough calcium without getting too much. So what does that look like? When it comes to calcium, the amount you need is going to be based on your age, and also we need to consider whether you are taking hormone therapies. So for individuals at any point in time, at any age taking hormone therapy, the recommendation is going to be 1,200 milligrams of calcium a day. Otherwise, it will be 1,000 if you're under the age of 70, or 1,200 if you're over the age of 70. But when it comes to calcium, too much for anyone is going to be 2,000 milligrams or more a day. Because there are some very rich food sources of calcium, it's important to find out how much calcium your diet is already providing you before you start to take any calcium supplementation. We only want to top up from our dietary intake with a supplement with what we're not yet getting. When it comes to vitamin D, if you're taking hormone therapy, 1,000 international units a day is the recommendation. For those under the age of 70 not taking hormone therapy, 600 international units a day. And if you're over the age of 70 and not taking hormone therapy, it's 800 international units a day. In Canada, the recommendation is for everyone over the age of 50 to obtain at least 400 international units of vitamin D in supplemental form. When it comes to vitamin D, our upper amount here is 4,000. So it's quite a large gap between what we need and what is too much. And that's why supplement would be the key recommendation for vitamin D to support meeting our needs, especially because we know that the dietary sources of vitamin D are fairly limited. So if we're looking at food sources for calcium, as we can see in the lower part of the table, some of the most concentrated sources are our dairy products, naturally providing rich amounts of calcium, as well as fortified soy beverage or other plant-based beverages. Other food sources also provide calcium, but not in large amounts. So we know broccoli provides a little bit, almonds also some, white beans. If we eat the bones in canned salmon, we're getting some good amount of calcium. These are not foods we tend to eat in large amounts or on necessarily even a daily basis. So if you don't have dairy products or plant-based milk beverages in your diet, it's really important to assess how much calcium you're getting. And you can use a tool from the Osteoporosis Canada website. They have a calcium calculator that it can step you through your food choices and give you an estimate of how much calcium you typically get. You can learn then more about which foods give you calcium, might consider increasing some of those foods in your diet, or learn about whether you might be needing to top up with a calcium supplement. Sorry. So when it comes to some of the side effects of cancer treatment, with hormone therapy, hot flashes is a common side effect caused by treatment. It involves a sudden feeling of warmth, and the severity of this symptom can vary from person to person. From a dietary standpoint, there are some common triggers such as hot foods, spicy foods, hot beverages, caffeine, and alcohol. And these types of foods will affect people in different ways, from minimal effect to quite significant effect. Keeping a food and symptom journal where you track what you eat, and then avoiding foods that you identify as triggers to see if your symptoms lessen, and then re-challenging with those foods to see if the symptoms return, can help you discover which individual foods or amounts of foods that you may or may not tolerate. Definitely talk to your doctor if you're experiencing hot flushes. There may be more effective non-dietary approaches. Diarrhea is a symptom that can be experienced with radiation treatments to the prostate area. The treatment occurs because the prostate is near to the colon, and so some of the side effects of the radiation are noticed in the bowel. Diarrhea in this instance would involve loose or watery stool, abdominal cramping, or increased urgency. And there are specific instructions that you would follow for bowel and bladder preparation prior to radiation treatments to minimize the risk of developing radiation related diarrhea. So this would be something you would be instructed to follow by your treatment center. If you are experiencing diarrhea, you would stop taking any laxatives, which might worsen diarrhea. From a dietary standpoint, you can adjust the fiber in your diet. And for some people, less fiber is effective. For other people, it's about reducing more of the insoluble fibers and increasing soluble fibers, such as found in oats. And this is where working with a dietitian at the treatment center or booking a one-on-one can help you have some individualized guidance for diet review. Some other common bowel stimulants that can be minimized or avoided include caffeine, spicy foods, very greasy meals or fatty meals, alcohol, and sugar alcohols. Sugar alcohols include things such as sorbitol, which we tend to find in low sugar candies and chocolates. If you're having diarrhea, a lot of loose, frequent watery stool, it's important to replace the fluids you're losing by drinking plenty of water, 8 cups of fluids a day. And typically the diarrhea starts maybe about 10 treatments in and lasts through the duration of the treatment, and then gradually improves within a couple weeks after the treatment. So it is something that you may need to get one-on-one guidance on if it's persisting during that time frame. And you can access also some further information on the BC Cancer website on low fiber food choices. And this would be available on their www.bccancer.bc.ca under the nutrition information. So it's a booklet of fiber content of foods that lists foods as high, medium, and low in fiber. For those having diarrhea, you might want to opt for foods more in the low fiber column, and or some moderate, medium fiber foods in small amounts. After diarrhea resolves, usually a couple of weeks after the treatment is finished, then you slowly want to return to having some of those higher fiber foods in the diet for the long-term goal of having a high fiber plant-based diet. Now, as we're nearing the end of our presentation, I'd like you to think about whether there is anything you would like to do for your health in the next week or two. Maybe you identified some aspects around plant-based eating that you could focus on, or maybe you're actively dealing with symptoms and need to reach out for one-on-one care. If you've identified something, take some time to think about what you could work on, how you might make some changes, and when you might start those changes. It can take time to make dietary changes, but it is okay to make small incremental changes over time that can have a very powerful and beneficial effect on our health. Encourage you to slowly make these changes and make them everyday habits in your life. If you need any support in making dietary change or identifying nutritional priorities, please reach out for a one-on-one appointment. You can also access further information about healthy lifestyle from the Canadian Cancer Society, and they have a website, as well as HealthLink BC is a service where you can speak with a dietitian by calling the number 811, and they're available Monday to Friday. So for further information about the Prostate Cancer Supportive Care Program, or to book a one-on-one nutrition consultation, you can contact the program at 604-875-4485. Thank you for your attention today.